My name is Angela. I'm a nurse practitioner student at the University of Memphis, and I'll be conducting your head-to-toe assessment today. So let's go ahead and get started. Throughout the assessment, I'm going to be looking at your skin for overall color, texture. I'm going to be looking for any scabs, scarring, masses, and skin turgor while we're at. So I'm going to start by inspecting your head. I'm going to inspect your head for size, shape, how your hair is distributed over your head. Everything seems to be good. I don't notice any masses, no infestations. Hair is good. So the next thing I'm gonna do is I'm gonna move to your temporal arteries. I'm gonna palpate those. Any pain or tenderness?
No.
Okay. So the next thing is gonna be your temporal mandibular joint. I'm gonna reach back here. Any pain or tenderness?
No.
No signs of crepitus or subluxation. If you could just take your jaw and move it left to right for me. Good. Okay, so now I'm gonna palpate your lymph nodes. So pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and clavicle. Okay, so now I'm going to palpate your trachea. Trachea is midline with no masses noted. Now I'm going to palpate your thyroid. If you can just swallow for me. Thyroid is good. Now we're going to move to your sinuses. Any pain or tenderness in your sinuses?
No.
Okay, good. So your nose is symmetric, no discharge noted. Your nares seem to be even and all that. So if you would just occlude one nostril for me and breathe in and switch to the other side. Good. Okay, so now I'm gonna just kind of feel your ears. Any pain or tenderness there?
No.
Okay, so no masses noted on the pinna or tragus. So the next thing that we're going to do is we're going to move on to your cranial nerves. So we're going to start by checking your vision with cranial nerve 2. There's a Snellen chart over here. If you could just read the smallest line that you can read.
F-E-L-O-P-Z-D.
Very good. Cover one eye and read that same line backwards.
D-Z-P-O-L-E-F.
All right, and cover your other eye and read that same line forward.
F-E-L-O-P-Z-D.
Okay, and now we're going to check your peripheral vision. So cover up one eye, and I'm going to move my fingers in, and I just want you to tell me when you see them.
No.
Okay, now cover your other eye.
No.
All right, and now we're going to check your central vision. So cover up at one eye. Tell me how many fingers I'm holding
2.
up. All right, cover the other eye, and tell me how many fingers I'm holding
3.
Good. All right, so cranial nerve 3, 4, and 6. We're going to test your pupils and just kind of see how they react to light, and then we'll be checking a couple other things, but we'll start with checking your pupils. So just look straight ahead for me. Good. Pupils are equal, reactive, round to light with convergence. And now we are going to check how your eyes react to following my finger. So I just want you to focus on my finger and follow my finger with your eyes. Good. Okay. So cranial nerve 5. I want you to clench your teeth. I'm going to check your masseter muscle. Any pain or tenderness? Okay. Close your eyes for me. I'm going to place a cotton swab on your face. I just want you to tell me now when you feel me touch your face.
No. 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 No.
Good. Okay. So the next thing is going to be cranial nerve 7, where we're going to test your facial expression. So if you could smile for me, frown, puff out your cheeks, pucker your lips, and raise your eyebrows. Very good. Okay, so cranial, oh, nope. Now I've got to look into your eyes. I'm just going to check in your eyes, looking for your red reflex, looking at your cornea and your conjunctiva. Sorry, bright light. Very good. All right, so cornea, everything looks good there. Cornea is normal, no abnormalities noted. Eyelashes look good, no discharge. Lids are good. So the next thing that we're gonna do is we're gonna move on to cranial nerve 8 and check your hearing. So if you could occlude one ear, I'm gonna do the whisper test. I'm gonna whisper 2 words and you tell me what you hear.
Apple, banana.
All right, now the other side.
Boy, girl.
Good. All right, so now we're gonna do the Weber test, and I just wanna make sure that you can hear the sound equally on both ears. So I'm gonna place this over your head. Can you hear this equally?
Yes.
Okay. And now we're gonna test how well you hear through the air. So I'm gonna place this behind your ear. Tell me when you can no longer hear it.
No.
All right, can you still hear
Yes.
it? Good. And then we're gonna repeat it on the other side.
No. Yes.
Good deal. Air conduction is longer than bone conduction. So now I'm going to actually look in your ears, looking at your tympanic membrane and your internal structures and make sure that everything looks good there. Okay, tympanic membrane is translucent and pearly white or pearly gray. Internal structures are noted in both ears. Very good. So cranial nerve 9, 10, and 12. I'm going to look in your mouth. So I want you to stick out your tongue and say ah. All right, uvula rises. Can you raise your tongue? All right, so tonsils are not noted in the back. Oral mucosa looks good. No teeth missing or anything like that. So the last cranial nerve that we're going to do is cranial nerve 11. So I'm going to place my hands on your shoulders and I want you to shrug against my resistance. Good. So now we're going to move on to your lungs. I'm just going to watch you breathe for a second. You have normal rise and fall of your chest. Chest expansion is good. No tachypnea or cyanosis. No accessory muscle noted. So I'm going to come to the back and I am going to place my hands here on your back and I'm going to pinch a little bit and I want you to take a deep breath. Good. Posterior expansion is good. So now I'm going to test for tactile firmitus. So anytime you feel my hands touch your back, I just want you to say 99.
99. 99. 99. 99.
Very good. And so now I'm going to percuss your lung field. So I'm going to place my finger and you'll feel me kind of tap a little bit. So now I'm going to listen to your lung fields in the back. Anytime you feel my stethoscope touch your back, I just want you to take a deep breath. Okay, now I'm going to listen to your lateral lung fields. Very good. So now we got a couple more things to do. I'm going to place my stethoscope on your back and I just want you to say 99 when you feel me place it.
99. 99.
Okay. Now say E.
E. E.
Okay. And then whisper 1, 2, 3. Very good. Everything sounds like it should. So now I'm going to come to the front and I'm going to also do the tactile firmitus on the front. So when I say 99, or when I place my hands on your skin, I want you to say 99.
99. 99.
Good. Got some breast tissue, so I won't be able to feel much more. So now I'm going to listen. So when you feel me, take a deep breath, okay? Raise your shirt up a little bit. now we're going to feel your carotids, listen to them, and I'm gonna listen to your heart tone, okay? Carotid pulses feel normal. And now I'm gonna listen to your carotids for any worries with the bell of my stethoscope. So if you'll hold your breath for a second. Good, now breathe, and then we'll repeat that on this side. Good, and now I'm gonna listen to your heart, so if you'll just breathe normally. So we got the aortic valve, pulmonic valve, Erb's point, tricuspid valve, and mitral valve. And normally I would listen to your mitral valve or your apical pulse for a full minute, but for time constraints, we're not going to do that today. So if you'll just lay down for me, we're going to listen to some more points on your heart. I'm going to listen to the same landmarks on your chest with the bell of my stethoscope. Raise your shirt up. Good. And now I'm going to listen to your aorta, iliac artery, renal artery, and femoral artery. Very good. No heaves or lifts are noted. So now I'm going to palpate for any thrills along those same areas that I just listened to. Good. Okay, so now I'm going to mainly just focus on your stomach now. So everything we're going to be doing is on your stomach, so you don't have to worry about breathing or doing anything weird at this point. So your stomach is good, flat, non-distended, no masses noted. No pulsations noted, so I'm going to listen to your bowel sounds starting in your right lower quadrant. Moving to your left lower quadrant, left upper quadrant, right upper quadrant. Good. Okay, and so now I'm going to percuss your stomach for any dullness, tympany, or flatness noted. So I'm going to kind of beat on your stomach like I did on your back. All right, tympany noted. So now I'm going to palpate for any masses or tenderness. So if any of this hurts, just kind of let me know. Okay, no masses noted. Now I'm going to try and feel your liver. So if you'll just take a deep breath for me. Good. Catch your breath. And then we're going to do the same thing for your spleen. All right, so let's go ahead and sit up. I'm going to go around back here, and I'm going to put a thump your back, testing for costovertebral angle tenderness. So if any of this hurts, just let me know. Okay, good. Okay, so now we are going to move on to your musculoskeletal system, where we're just going to kind of test your strength and your range of motion. So let's start with your neck. So if you will put your chin to your chest, good. Extend it back up, hyperextend it towards the back, good. Put your ear to your shoulder, now to the other side, and now turn your chin to your shoulder, and now the other side. All right, and we're going to do that same thing against resistance. So turn against my resistance, very good. All right, so now I'm going to check your joints and your hands and everything. Just kind of make sure that your joints are not inflamed or swollen. Check your skin turgor. All of that looks good. Skin turgor is good. All right, so now we're going to test the range of motion in your fingers. So if you'll just hold your hands straight out like this, flex them down, extend them back up, hyperextend, good. Spread them out, make a fist, and then I want you to touch your thumb to each finger. Very good. So check your radial pulses. Equal. All right, squeeze my fingers. Good hand strength. Now we're going to test the range of motion in your wrists. So just like before, flex them down, extend them back up, hyperextend back to the middle, ulnar deviation, radial inversion, and then just kind of circle for me. Good. Okay, so the next thing we're going to test, I'm going to place an object in your hand, and I want you to close your eyes and tell me what that object is, okay?
Key.
Okay. And now we'll put another object in your other hand.
Bobby pin.
Good. All right, so with your eyes closed, I'm going to write a letter in the palm of your hand, and I want you to tell me what I write.
7.
Good.
3.
Awesome. All right. And the next thing we're going to do is I'm going to test for any ulnar vibrations that you may have in your ulnar. You feel any vibrations there?
No.
Okay.
No.
Good. All right. So now I want to check your brachial arteries. Very good. Now we're going to test your elbow strength. So straighten your arms out. Don't let me push. Don't let me pull. Flex your arms up. Same thing. Don't let me pull. Don't let me push. All right. So now let's test your shoulders. Arms straight up. Back down. Hyperextend behind you. Cross them behind your back. Bring them up over and cross them behind your neck. And bring them out. Awesome. Okay. So let's bring this arm back up. Same thing. Don't let me push. Don't let me pull. Over here, don't let me push, don't let me pull. And let's check your biceps and your tricep strength. So we're going to go forward and backwards. So, okay. Good. All right. So before we move down any further, we're going to test your deep tendon reflexes. So I'm going to test your brachial radialis here. And your brachial. And I'll bend your arm this way. We're going to test your triceps. Okay, now we're going to do your patellar. All right, and then I'm going to come down here and do your Achilles. And then I'm going to rub this up the bottom of your foot and test your Babinski reflex. Good. Okay, so now your capillary refill and your toes are good. I'm going to check your pulses. Posterior pulse is equal. Dorsalis pedis pulse is good. Push against my resistance. Pull your toes towards your nose and don't let me pull back. Good. Now I want you to take your big toe and kind of turn your foot inward. Now bring it back upward. Same on the other foot, inward and then upward, and then just kind of circle all around. Good. All right, so now we're going to lay back down, and we are going to test some more range of motion and strength. We're going to start in your knee, so if you'll bend your knee, don't let me push, don't let me pull. Same thing, don't let me push, don't let me pull. Good. This knee, bend it up, don't let me push, don't let me pull. Here, same thing. All right. And now we're going to check the strength and a little bit of range of motion in your hips while we're laying down. So we're going to abduct your hip out. Same thing. Don't let me pull or push. Abduct it back in. Same thing. Don't let me pull or push. Abduct it out. Don't let me pull. Don't let me push. In. Don't let me pull. Don't let me push. Okay, and now we're going to check some rotation of your hips, some range of motion in your hips. So bend your knee again. I want you to turn your knee inward, bring it back out, and bend your knee up. Awesome. Do the same thing on the other side. In, out, and back up. Okay, now let's sit up. We'll sit up, and we've got just a couple more range of motions that we're going to check on your hips and knees, and then we'll move to your spine. So stand up for me. All right, so turn towards the bed, that way you have something to hold on to. Flex your knee backwards, like bend it backwards. Great. Other leg. Okay, now hyperextend your leg back. And now on the other side. Good. And one last thing to check your hips. Let's see your circumflexion. So I just want you to draw a big circle with your leg. Good, good. Okay, so now we're gonna check your spine. So I want you to just slightly bend forward. I'm just gonna check the curvature of your spine. Alignment is good. Stand back up. And I'm just gonna palpate your spine. Let me know if there's any pain or tenderness here. Good. All right, so one last thing before we start taking a little walk. I want you to turn towards me, and we're gonna check your range of motion in your hips. So I want you to bend forward. Great, extend back up. Hyperextend just a little bit, good. Bend your hip, bend to the right, bend to the left, and then turn to the right, and then keep your hip straight, and then turn the other way. Good. Okay, so now, last thing, we're going to test some walking. So I want you to just take a few steps towards the wall over there, walking normally. Good, gait is good. All right, turn back towards me, and I want you to take a few steps heel to toe for me. Good. Now, if you could repeat that with your eyes closed. Awesome. Okay, so we're going to stand here. I just want you to stand. I'm going to test your proprioception, so I want you to just stand here. I'm not noting any swaying or unsteadiness, so if you could just close your eyes for just a second. Same thing. Good. So now we're going to really see how coordinated you are. I want you to take your hands flat, and I want you to just kind of flop them on your, good, okay, and then I want you to put your finger on your nose, and I want you to touch my finger every time I move it, and then return your finger back to your nose. Good. Good. One more time. Good. And then extend your arms out, and I want you to alternate touching. All right, now close your eyes, and let's repeat that again with the touching your nose. Good. Okay, and can you hop on one foot for me? Good. Now the other foot. Okay. And I think that covers everything. So, well, this concludes our head to toe exam. No abnormalities found. You seem to be in pretty good health. So, thank you.